Hi, my name is Mike. I'm a retired physical therapist and physical therapy professor here in Pennsylvania. What brought me to Drayer, my wife and I had recently moved to the area, and I knew I was going to need a knee replacement. So one of the graduates of the university where I used to teach, in fact many of them live in the area, and I spoke with them, and one in particular recommended a particular surgeon, and Drayer PT had a facility right on that same campus, and he was working for Drayer, so this makes sense, as was at least one of the graduates. So had the surgery done, attended physical therapy there, great outcome. I was very pleased on how everything went. To come here to work with Mike, I went back to that same physical therapist who worked at Drayer because not all physical therapists have the same level of expertise working with partial rotator cuff tears. Some physical therapists specialize in certain things, and I was looking for someone who had a great deal of clinical experience in working with someone who had a partial rotator cuff tear. And the therapist down at the Drayer Institute suggested Mike, and so that's how Mike and I connected.
Mike came to me for problems with his right shoulder. He was having some rotator cuff issues. They found some tears on MRI. He really had a lot of issues reaching behind his back and overhead, and just chronic irritation over and over. He couldn't beat it. So he came to therapy to see if he could knock that pain down and get his arm back. What we did with Mike was we first broke down his posture. There were some things about how he was sitting and how he was moving on a daily basis that I think were chronically re-exacerbating his symptoms. So once we delved into that, then we could get into some manual techniques to really stretch out the shoulder, make him feel better when he moved day to day. And then what I always like to do with patients who have shoulder issues is really strengthen the supportive musculature. So when he's getting back to his normal everyday stuff, he doesn't flare it up again. So we're treating what he has now and also trying our best to prevent it from coming back. So a lot of stretching, exercises, and lots of education to keep him on the right path.
I'm happy that I chose Drayer because, first of all, because of the outcome. I was very hopeful that I would attain what I attained. Pain-free, full range, back to doing what I would like to do. I was happy also because the way that Mike and I worked together. Again, he was interrogative. I asked any question I wanted. He asked me a lot of questions. It was not just therapist to patient driven. It was very much level playing field, if you will, which I thought was very important. Location was very important to me. It was only 15 minutes from home. Scheduling was easy. And unlike some clinics that I've been associated with, here things ran on time. If I had a 2 o'clock appointment, within a couple of minutes, either at 2 or a couple of minutes after, Mike was calling me back. And I appreciated that because I have other things to do. To put it all together, I am very pleased that that Drayer Physical Therapy was recommended to me. I'm very pleased with how things went, and I am especially pleased with the outcomes, and I would recommend Mike as a physical therapist to anyone.